Hello, everyone. First of all, I would like to say thank you for Korean Society of Integrated Medicine Journal for inviting me to join as the speaker for providing the special talking related with my experience in clinical practice and my research today. So I am Dr. Komak Sinsurin. So I am a sport physical therapist. So this is my talking today. It's related to non-contact ACL injury risk and risk assessment. Okay. So this is where I'm from. So I work as the lecturer and also the researcher at Faculty of Physical Therapy, Mahidol University in Thailand. So as you guys have known that mostly the non-contact ACL injury is occur during one leg landing and also like one leg cutting during change of directions from running. So you can see this guy, for example, they jump and landing, but you can see that trunk also rotation during they perform or they're floating in the air. And after that, they're landing with the single leg landing. And also you can see this guy after smashing, you can this guy would like landing with single leg landing, and you can see his trunk also rotational movement during the flight phase as well. So that's why most kind of the biomechanics research, they try to examine the influence of biomechanics risk. That would be the biomechanic contributors to the risk of non-contact ACL injury. So mostly the non-contact ACL injury occur during single leg landing. So this is the examples of the non-contact ACL injury occurring during single leg landing. So you can see this girl, after she was landing with a single leg and she suffered from the non-contact ACL injury on the left knee. So this is the typical patterns of movement occurring during non-contact ACL injury. But when we try to analyze in detail, mostly the research suggests that the dynamic defocus is the main parameters or the major parameters that contributing to non-contact ACL injury. But anyway, if it's lateral trunk leaning or the excessive hip abductions or hip internal rotation, these are the confounding factor. These are the contributing factor to the non-contact ACL injury as well. Okay. It's the typical pattern of the dynamic defocus during cutting movement. Okay. So we are the health profession. We think that the prevention is the most important intervention that we should provide for all athletes to prevent the injury. So the prevention is much better than effective intervention. Absolutely. So that's why how can we design the prevention program? So right now the injury risk assessment is very important to investigate the risk of non-contact ACL injury. If the health profession can assess the risk of injury, so we can provide the intervention or physical therapy program or rehabilitation program for our athletes to prevent the non-contact ACL injury. So these are the common the clinical assessments for the athletes during landing and also during the cutting movement. So let I introduce the first one, which is we call the LASS, or it stands for Landing Error Scoring System, which is a field assessment tool for identifying potential high-risk movement patterns, or we try to identify the movement error during double leg jump landing. So LASS is based on the continuous 17-point scale and show having a concurrent validity with the 3D motion analysis and good inter and intra-rater reliability. And the more score of the result mean high movement errors and having a chance of sustaining ACL injuries. And the cutoff score to identify the non-contact ACL injury, if the assessment score it's more than and equal 5, so we can identify that athlete who has the high risk for sustained ACL injury. Okay, and this is the testings of the landing error scoring system. So we ask the athlete stand on the platform, 30 centimeter high platform, and set the distance from the platform to the landing point is approximately 50% subject height or athlete height. And then we ask them to jump and landing with the double leg and try to jump immediately with the highest height as the athlete can. So after that, during we test the jump and landing task, we record the video in the front view and also the side or the side view as well. Then we use the video recording and then we scoring the movement error in all items here. So if we found some movement error, so we're going to give the score as 1. But if absent movement error, so we're going to give score 0. So for instance, in the movement assessment, the first criteria, which is the tester or the sport PT going to observe the knee flexion at initial contact. So in the video to observe the knee flexion, so we're going to take a look on the video in the side-by-side view to observe the knee flex. If the knee flex is flexed less than 30 degrees at the initial contact, so we're going to give score like 1. But if the athlete contact the ground with like more than 30 degrees of knee flexion approximately, so we're going to give score 0. So this is the for example. And the second item, so we're going to observe the hip flexion at initial contact phase here. So we observe the thigh is in line with the trunk at initial contact. So that means we observe how the jumper contact the ground with how like the jumper set up the trunk relative to the pelvic or the thigh. So if the jumper landed or the contact the ground with like more trunk flexion, so we're going to give 0. But if the thigh segment which is in line with the trunk, so that means the movement during initial contact is quite like similar as the straight line, so which is the risk of like high impact during landing, so we're going to give score as the 1. So the health profession can observe all items here and give the score in each item, and then some summation or score at the end. So if the score like greater than, if the score greater than 5, like 5 more than and equal than 5, so that like athlete has the higher risk of non-connected ACL injury. So as we are the physical therapist, so we can like use this assess the risk of non-connected ACL injury at the first round. When we assess the first round and we found like total score of lead is quite high, and we found the presence of movement error in which item, so we can provide the instruction or educate them how to land with the correct movement, and then let them have the training and rehabilitations, and then we can reassess with the less or the landing movement error score system again to observe each criteria or each item again, and also compare each item and also compare the total score between round 1 and round 2. So then we can like we can see the progression after we provide the preventive program. So this is the how can we use the assessment tool. And the second assessment tool, so we call the modified landing error scoring system, or we call LESM. Actually, this is our work in my lab. So we conduct this kind of research to develop like a modified version of LES in order to fill some gaps or some limitations of the LES. So as I mentioned earlier, the LES, we asked the athlete to perform jump and landing with the double leg and also in the forward direction. But actually, as I like introduced you in very like first or second slide, so mostly the athlete perform jump and landing, and sometimes they rotate their trunk or their movement during jump and landing, and also they perform jump and landing in various directions. It's not jump and landing perfectly in vertical or just only the forward direction. So we thought that the landing error scoring or assessment, so we should assess in the risky direction as well. That's why we modify the LES and we call LESM. So the original LES limitation was jump landing test with double legs in forward direction, as I mentioned, and we developed the LESM is designed to assess lateral single leg jump landing. So we decided to design the jump landing task with this, we change from double leg to the single leg, and also we ask the athlete to perform jump landing in lateral direction. As our like previous study, we confirmed and we found that lateral directions of landing show the higher risk of non-contact ACL injury than the forward direction. That's why we designed the jump landing in lateral directions. This is the all items criteria of the LESM that we developed from the literature review and also our previous studies. So finally, we have like 12 items. So, and we try to design the LESM to easier and like easier for using and like not like too complexity for all clinicians. So we separate in the testing plane into 2 planes, so including forward planes and sagittal planes here, and we ask the tester to observe the trunk, pelvis, and hip joint, knee joint, and ankle joint. So the first item, the tester or the clinician have to observe the ipsilateral leaning of the trunk towards the landed leg during the landing phase. So like very like high trunk leaning to the stand limb, so which is quite high loading on the landed side. So we identify as the risk of injury. So, and the second item, we need to observe the contralateral pelvic drop during landing. The third item, presenting hip abduction or internal rotation at initial contact, showing displacement of knee valgus motion after initial contact. We also observe the participant lands with a toe out positions of the ankle. So these are all items that we're observing in the frontal plane. So how about the sagittal plane, or we need the video capture that we place the camera in the side by side or in the side view. So we observe the upright or extended trunk during the landing phase. We observe, or is there any like obvious or detectable trunk rotations movement during the landing phase, or like how the hip is flexed, like less than 40 degrees at initial contact, or knee is flexed less than 20 degrees at initial contact, or the jumper like land with the hyperextension of the knee during landing phase, or participant land without forefoot contact. And the last item we observe, ankle is plantar flexion to like less than 20 degrees at initial contact. So, and then we some score for the left side and for the right side as well. Okay. Firstly, we can compare like the score, total score between limb, and also we can like compare total score or compare by item between as like repetitive assessment in round 1, round 2, or round 3 to observe the progression of our case as well. So after we develop the LESM, we conduct the research to test the content validity assessment. So we invited 5 experts in the field to assess the content validity. So this is the statistical analysis to observe the content validity with the CVI or content validity index. And we found that the average content validity index, it is like 0.97. So it's pretty high. So it means that LESM has high content validity from 5 experts in like various countries. And next, we also comparing the LESM measurement to the standard motion capture or the 3D motion analysis. So we asked the jumper or the athlete to perform single leg jump landing in lateral directions. Doing we capture the 2D camera as the LESM protocol, and also we capture the 3D motion with the Vicon motion analysis at the same time, as we show on the figure here. Right, so we capture the movement at the same time, and this is the example of the video example during we capture single leg landing in the lateral directions. Yeah, and this is the figure during this is the when we ask the jumper stand on the platform and then landing at the center force plate here. After finished, we construct the 3D motion model to extract the knee valgus angle, and we compare or we investigate the correlations of the total LESM score and also the key parameters, key biomechanical parameters that we extract from the 3D motion analysis, which is knee valgus in this study. So we found the moderate correlations between LESM score and knee valgus with significant. So the coefficients like 0.4 to 5, and also we found the moderate correlation of the LESM score and hip abduction moment equal 0.446 with significant. So as we conducted the research, we summarized that the LESM show high content validity and moderate concurrent validity. So the LESM could serve as a potential tool for identifying non-contact ACL injury risks. So is there anyone interested to read through this study in detail? So you can go to the Physical Therapy in Sport journal, and this is the reference, or you can scan this QR code. So then you can download the full version of the LSM as well. All right, and we expect to expand for all health professions, including in sport science field or in the sport medicines or the sport physical therapy field, to use the LSM, which is assess the risk of non-contact ACL injury with the SI to assess in the single leg landing in lateral direction, which is more challenged than the original LES. Okay. All right. Okay. All right. Let's move to the measurement tool in the next measurement tool, which is the cutting movement assessment score, or we call CMAS. Okay. So the CMAS is qualitative screening tool that assess cutting movement quality and specific lower limb and trunk characteristics that are associated with non-contact ACL injury. Okay, and the CMAS may have the potential to identify athletes displaying high-risk cutting mechanic, but more importantly, could be used as a technical framework for coaching safer cutting mechanics. Again, so we can use our measurement tool as the assessment tool. After we like use this assessment tool to identify the movement risk or the movement error or the risk of non-contact ACL injury, we can provide intervention or rehabilitation or the preventive program. And then after finish the program of the preventive interventions, so we can reassess again. So this is quite have the this is the benefit that we get from the assessment to like compare round 1, round 2, and observe any like item that change from like present to absent, absent to present, and compare between round 1 and round 2, something like that. So it's pretty helpful. But anyway, the cutoff score for CMAT, they suggest the score of 7 to identify the like high risk of non-contact ACL injury. So this is the cutting task that we also like place the camera in front view, and also the inside view as well to observe the movement error in like side by side, and also observe the movement error in sagittal movement. Okay. Again, this is asked to cutting with the maximum speed as he can. Okay. Okay, and then we use the recording video, and then we scoring all item here of the CMAS. Like if we can observe the movement in each item, so we're gonna provide a score 1 or 2 or 0 by item, and then like sum the score as the total score. Okay. Yeah, that's the CMAS. So this is the all like example of the measurement tool or the clinical tool that we can apply in the field to assess the athlete in jump landing tasks and also in the cutting tasks. So you can pick up like LSM or CMAS to assess the athlete performance. But anyway, you need to consider you're going to pick up LSM or the CMAS depends on like sport type or the sport athlete. For instance, if you assess the risk of non-contact ACL injury in volleyball players, so I would say, okay, the LSM would like more appropriate to assess the risk of injury rather than the CMAS. But because we want in volleyball player, mostly they perform jump and landing, not cutting, right? But if you assess the risk of injury for the soccer player, so I would say, okay, CMAS would be like more appropriate. But if you would like to assess in basketball players, so I would say, okay, you can like pick up both like LSM and also the CMAS as well. As the basketball player, usually typically they perform jumping, landing, and also running as well, cutting as well. So that's why we need to assess both types as well. Okay. So, okay, to the last, my whole message for my talking today. So jump landing direction significantly affects on lower extremity biomechanics. So as we are the health profession, we need to assess in all directions as possible. Like if we can assess in all directions, that would be perfect. But if we cannot like, assess in all directions, so I would say, okay, we need to prefer like what in the direction that's very challenging for the athlete to observe the risk of injury. Okay, and the measurement tool should be used in order to risk screening for injury prevention. And the LSM could serve as the potential tool for identifying non-contact ACL injury risk. And last one, okay, for the research in the future may focus on the effective of rehabilitation or neuromechanics parameter in athletes with ACL, which is in our lab now we have developed the innovative rehabilitation for athlete after reconstruction and also in athlete with chronic ankle instability as well. So hopefully we can publish the result in the next year. So stay tuned. to see our result, and then you can apply the rehab program or the physical therapy for your patient or your athlete. Okay, that's all my talking today. Hopefully, it would be like provide some benefit for you guys. Okay, and lastly, I would like to like thank you for my consultant and also my postgraduate student, also the alumni in the biomechanics and sport laboratory of Faculty of Physical Therapy, Mahidol University, to contribute to all this, contributing to the knowledge and research information that I presented for you guys today. Okay, that's all my content today. So thank you very much.